knew I wanted to be in the healthcare field. I knew I wanted to work in a hospital. I just didn't quite know what I wanted to do. I had a lot of family members come to Kirkwood, so I always knew about the school. And I saw that they had a respiratory program here, so I looked into it. I saw it was 5 semesters, so it's 2 full years and a summer semester in between. And I thought, wow, that's super fast to be able to get my degree and be able to take my board exam and get my license and immediately just start working. Seeing that the program was right here at my fingertips, I couldn't not go ahead and jump right in.
I decided to be a respiratory therapist because I knew I wanted to do something in the medical field and helping others. And then after the COVID pandemic started, there was just a huge need for respiratory therapists, and I heard there was a shortage, and I was like, what's a respiratory therapist? And went from there.
Being a respiratory therapist, we play a vital role in assessing patients that have breathing disorders and cardiopulmonary disorders. And we also tend to take care of patients that need that cardio-resuscitative support by providing mechanical ventilation, resuscitative devices, premature infants that need support with breathing, or adult patients that have chronic lung diseases. We specialize in cardiopulmonary patients versus a vast variety of other things. So we build on that in every semester with those skills, but our students always said that that's one of the things that they like, that we specialize in one area.
The classroom sizes are very small. There's 14 people in my cohort. You form a really good bond with your classmates. They're some of my best friends. Kirkwood is super fortunate. They have a whole simulation center. It is set up like a hospital. The hallways look like a hospital. Each room is different. Paramedic students can practice in the ambulance and then wheel the patient right into the ER. There's an ICU room. There's a labor and delivery room, a pediatric room. Everything's recorded with video and audio, so you're able to watch yourself back and kind of critique yourself and be like, oh, next time I need to do this a little bit better. Here we get to fail and try again. We get to learn from our mistakes, and you get to perfect it before you go and do it on a real patient during clinicals.
Being in healthcare, most of your knowledge comes from that hands-on experience. It's very difficult to just read a textbook about all these things and then try to apply that knowledge in the real world. Like, you have to see it and you have to do it yourself. You kind of start work early with clinicals, and you're doing the things that you would do when you're graduated, but you're just in school still getting checked off for those things.
When the students begin going to clinical rotations as first-year students, they are applying their assessment skills. They're able to evaluate and treat with experienced professionals, kind of guiding them and overseeing. And as they progress through the program, they're able to offer their own ideas as to maybe what they think they should be doing for the patient. They're collaborating very closely with physicians, nursing, outpatient caregivers as well. And then as they progress through the program, they're taking care of neonatal infants. Since we take care of patients from birth to the end of life, they are seeing all of these experience in clinic, and it really cements their knowledge that they've learned in the classroom, so that when they have confidence at the end of the program and they're ready to graduate, they feel very ready and prepared.
If you get into this program and you make it through, if you don't find a job, it's because you didn't want a job. It's so easy, and there's so many places hiring in Eastern Iowa and across the country where, you know, they want RTs and will hire new grads. But for Kirkwood especially, they did such a good job at being hands-on and making sure that not only we got the exposure to these facilities that are potential employers, but that these employers even sometimes came and visited the campus to kind of recruit us. And that's how I actually found my job at the university. They came and recruited us early. So everyone in my class was hired on before we graduated, like, obviously. So the demand is there, not only in Eastern Iowa, but across the nation, you know. If you have what it took to get in, you have what it takes to get out. And I know it's rough, and I know it's very hard, and it takes a lot of sacrifice, but I would say that given all that you go through and all that the work you have to put in, it's so worth it on the other side.